Hi, everyone. This is Trinae Simpson with the CareQuest Institute for Oral Health. Thank you for taking the time to join us. We're going to give folks a couple more minutes before we get started, but I'm really appreciating all the welcomes and introductions that are already happening through the chat. So thank you all for joining. Talk to you soon. Hi, everyone. Welcome to the Open Network-Wide webinar. My name is Trinae Simpson. I'm the Director of Grants and Programs at CareQuest Institute for Oral Health. I want to just start by saying a huge appreciation and thank you in advance to you all for joining us as we set the stage for 2023. We have a lot of topics to cover today, so let's get right to it. Thank you. So first, a couple of housekeeping items. So this webinar is being recorded. You'll receive a link to the recording plus the slides following the event. To reduce background noise and interference, everyone has been muted upon entry. We do have a set time towards the end of the call for Q&A, but in the meantime, we really welcome you and encourage you to add your questions or comments throughout the presentation in the specific Q&A chat box. We'll be monitoring the chat throughout the webinar. If we're unable to get to all of your questions, we'll follow up accordingly and do our best to address them in the follow-up materials. And so here's a quick look at our agenda for today's presentation. So we're going to start with a brief introduction of CareQuest Institute for Oral Health and welcome you all, as I said previously, to do this in the chat. So feel free to add your name, organization, where you're calling in from, and how many years you've been a part of the network. And if you're new, I want to take this time to welcome you. Next, we'll provide an overview of CareQuest Institute's specific role and what it means to be your backbone organization. You'll meet the Open Transition Network support team and hear a quick snapshot of some of the amazing wins from 2022. Next, we'll provide an overview of that actual open transition strategy and really end with some concrete next steps, some timelines, and we'll do our best to answer any questions that you might have. So thank you again. And with that, I'd like to turn it over to my colleague, Dr. Kaz Rafia.
Hi, everyone. Thank you, Trinae. Welcome, everyone. My name is Kaz Rafia. I'm the Chief Health Equity Officer at CareQuest Institute for Oral Health. I want to take a few minutes to introduce you to CareQuest Institute for Oral Health, and more importantly, our role as Open's backbone. Next slide, please. Thank you. At CareQuest Institute, we're focused on building a future where every person can reach their full potential through optimal health. Our vision for the future demands transformation of the existing oral health system into one that is more accessible, integrated, and equitable. We know that oral health must be included in the conversation around overall health if we are to make progress towards health equity. And as it stands, however, our health system doesn't include or work for everyone because it wasn't constructed as such, results of which are seen as unacceptable disparities among marginalized communities. And we aim to change that. Next slide, please. Thank you. At CareQuest Institute, our areas of activations are the engines of our work. It's through the combined and coordinated impact of grant making, research, education, policy and advocacy, and health improvement programs that we're able to drive impactful change and advancement towards health equity. Next, I'd like to highlight a powerful story of impact. Next slide, please. Thank you. While it took more than a decade to see meaningful change, as many of you know, as of January 1st of this year, more than 250,000 Medicaid beneficiaries in Hawaii became eligible. I can't help myself but smile. This is amazing. Became eligible to receive reinstated benefits for comprehensive oral health care. This years-long struggle to reinstate these benefits wasn't easy, but many advocates on the ground played a major role in this victory, including Patrick Donnelly, the statewide Oral Health Coalition Manager for the Hawaii Public Health Institute. If you're here, Patrick, big ups. And Nancy Partika, active member of Open and member of the Hawaii Oral Health Coalition. Nancy, I saw your name in the chat. Huge props. I especially want to call out the landmark 5-year retrospective study to analyze statewide ED for non-traumatic dental conditions and significant visible community support, and how critical they were in regenerating the momentum needed for this legislative victory. Congratulations to Patrick and Nancy. And to learn more about Hawaii's journey, you can read our recent blog posting. We'll add a link in the chat for everyone. Now I'll turn it over to Ife to share a few words about Open's achievements. Ife?
Thanks, Kaz. Really appreciate that. That really laid out the value of collective impact and why Open is so important to the work ahead of us. It also demonstrates the potential power that can be built with a closer alignment with CareQuest and the stability it can offer. Open has made some tremendous strides in the past few years. We've seen dental benefits and oral health being discussed in higher echelons and wider circles than ever. We've been instrumental in creating a buzz around several topics like the impact of oral health to overall health, the cost benefits of prevention, the importance of recognizing the social determinants of health, and expanding the workforce through teledentistry, dental therapy, and always doing our work through an equity lens. More states than ever have expanded dental benefits in Medicaid, like Hawaii, and we nearly got a dental benefit into Medicare, almost. Open has become, much better known, and I was thrilled to actually get the chance to see so many of you in person at mid-year when we rolled out the blueprint, our 5-year plan for system change. Now we need to keep this momentum going, and it's time to take the next step. And that's why I'm so glad that CareQuest has chosen to continue its commitment to Open and is in fact more closely aligning itself to Open by serving as Open's backbone as only it can do. It will assure the network's path to sustainability and even greater measurable impact in oral health, accessibility, and equity. I am very proud to be an Open member, and I look forward to our continued work in oral health, equity, and social justice together. And with that, I'll turn it back over to Kaz to share more about what this new design will look like. Kaz?
Ife, thank you so much. I appreciate it. This year, as part of CareQuest Institute's dedication to lifting up community voice and accelerating oral healthcare transformation, we're more closely engaging Open by becoming its sole funder and backbone. And here's what that means, and what I mean by backbone. In this role, CareQuest Institute guides the shared vision and strategy for the network's collective action. It convenes national members to deepen relationships and collaboration, evaluates the network's sustainability, measures the network's impact, staffs the network support team. And speaking of the network support team, I now have the distinct pleasure of introducing your transition network support team, Bianca Rogers, Francis Walsh, and Kay Schechter. I'll turn it over to Bianca next. Thank you.
Thank you, Kaz, and hi, everyone. My name is Bianca Rogers, and I've been deeply invested in the network since 2015 in various roles to support Open and CareQuest Institute. So I'm thrilled to be here to be leading the Open transition, and I am joined by two names and faces you're familiar with, Kate Schechter and Frances Walsh. Frances and Kate have worked with Open since its formation, and they are here to ensure a smooth transition. So the three of us make up your Open Transition Network support team. And so with that short introduction, I will now turn it over to Kate to take us through the next part of our presentation.
Thanks, Bianca. Hi, everybody. My name is Kate Schechter. I'm really excited to be back with you in 2023. So welcome back. Before we dive into Open's next steps for the coming year, we wanted to take a moment to reflect on a couple of the network response team wins from 2022, because we know how important it is to also celebrate. So today we are going to hear from the Health Equity Super NRT leads, Annalise Cothran from the LGBTQIA+ NRT, Bailey Rivas from the Medicare NRT, Joni Nelson from Rural, and then we're going to do another quick shout out for those states who have seen some great progress in Medicaid. But first, on behalf of the, sharing screen, okay. On behalf of the leads from the Health Equity NRT, Zill Joyce Dixon Romero and Christy King, and the larger group itself, I wanted to share out a few of the wins from that NRT in 2022. During which time, the Health Equity Super NRT continued to spotlight the intersections of health disparities and oral health, while also elevating ways to address systemic issues within our own respective organizations. And that looked like a couple of different things. One was the Health Equity NRT created a JEDI statement, a Justice, Equity, Diversity, and Inclusion statement, that was used to help Open as well as other organizations. And you can find that on Open Communities. We also toured the Laughing Bear Bakery while we were in Missouri for Open's mid-year convening and got to see how some ex-offenders are being reintegrated into a new life and a new job. And also began to include some guest speakers on the standing calls for the Health Equity Super NRT, such as Annette Davenport Hatter of Harambee Care, where we discussed the impact of implicit bias around race, gender, sexual orientation, and geography. And now I'm happy to turn this over to Annalise Cothran to share some about her NRT wins. Take it away, Annalise.
Thanks so much, Kate. I'm so excited to be here to share what the LGBTQIA+ NRT has been able to accomplish over the past couple of years and the excitement that I have for our success to continue. I'm only sharing a brief overview, recognizing that we've had a lot of wins and a lot of success, not all of which can be measured with a distinct deliverable. But the ones that can include monthly meetings to engage in policy and advocacy, both on the state and national levels, which included amplifying calls to action for those advocacy items and equipping members to be able to respond effectively to those calls to action. We were also able to create a toolkit on how oral health professionals can engage on the Equality Act and moving that forward on behalf of LGBTQIA+ people. And we're happy to say that we also celebrated the passing of federal policy to protect marriage equality specifically. Lastly, I'll just share out in October of 2022 that AIDPH hosted, in conjunction with the Open NRT, the LGBTQIA first inaugural LGBTQIA Oral Health Week in partnership with many national and state-based organizations to amplify ways to be able to advance oral health equity for LGBTQIA+ people. And we're happy to report that this will now be an annual activity that we do for this stakeholder group. So please participate in October of this year.
Thanks, Annalise. And then we'll turn it over to Bailey, please.
Hi, everyone. So the Medicare Learning Collaborative has been a key group in sharing strategy, messaging, and policy with the aim of making oral health coverage mandatory within Medicare. This group had some really important wins in the past couple of years. I think first and foremost, elevating Medicare oral health coverage as a mandatory oral health coverage in Medicare, elevating it as a key policy issue during the Build Back Better legislative drafts and conversation that were happening in 2021 and making it the most publicly popular provision of those conversations, which was huge. The momentum from that, the momentum from that conversation really helped achieve our other major win, which is actually getting medically necessary coverage in Medicare as part of the Medicare physician fee schedule, which essentially meant that for folks, it helped widen the definition of who qualifies as medically necessary oral health coverage care in Medicare. And this is important not only from the coverage aspect and that more people who need help are going to have it covered by Medicare, but it also just showed that the administration is viewing Medicare coverage as whole person care and that oral health is very key to that whole person care. So look forward to, continuing to push the issue with all of you, but some really, really big stuff over the past couple of years. So congrats to everyone who worked on that.
Thanks so much, Bailey. And Dr. Joni Nelson, please.
Thanks, Kate. Thanks, Bailey. So I've had the pleasure of facilitating the rural network response team alongside some great folks with some passion for rural oral health. Y'all can say that 3 times because I have had to for the last few years or more than that. But it's been a fun group. We took a stab at taking the blueprint levers and intersecting them with objectives that we had for our NRT that worked well for us. So we hosted several Take 20s, a couple of Take 30s, and collaborated on resources to disseminate amongst the open network, which are still there riding strong, and we have updated some of those, especially the compendium of best practices for oral health, which has been highlighted through the National Rural Health Association. And a couple of our folks that are on our rural NRT have highlighted some of their best works there as well. Most recently, this last year, we've been really excited about our virtual roundtables. So those roundtables were all around efficacies and strategies to advance rural oral health. The first of 3 that we had was medical dental integration, community prevention and education was the second, and the last was digital technologies and innovation. So each of those 3 roundtables were led by a national expert to ground us in that discussion. Following that, we had some pointed topical questions for the participants. We actually had some really good comments from that and good dialogue that went back and forth. And from that, it caught some traction, and some folks from NCSL, the National Conference for States and Legislature, invited me to participate on a webinar that they had on oral health workforce this past December. So we have been busy, folks, and we've had a lot of fun. And so we did not stop there. With the support of Annalise and Zill, we talked a little bit more about transferring this into a 1-pager conference proceeding report. So we're excited about what that's going to look like and the opportunity to have a tangible deliverable for the rural NRT in the format of a peer-reviewed manuscript. Hopefully, we'll have that together and outlined for a summer dissemination. Thanks so much.
Joni, thank you so much for sharing all of those wins. And thank you to everybody for sharing out today. We just wanted to wrap this section up, mentioning all of the incredible progress that has been made in expanding Medicaid adult dental benefits, including in the states of Hawaii, as we've already mentioned, Kansas, Maryland, my home state, woo-woo, Maine, New Hampshire, and Virginia. So open members from all of those states have all been really active in the Medicaid Adult Dental Benefit Learning Collaborative by sharing their knowledge and resources. So congratulations to all of you on your progress, and continue the great work. And now we were hoping to hear from folks in the audience. If you have any additional wins or successes that you want to keep riding the tide, please feel free to put those into the chat. We would love to hear from you. And with that, I'm going to turn this back over to Bianca. Thank you, everybody.
Thanks, Kate, and thank you to all of our speakers. I think it's really energizing to hear about all the progress that's happened over the last couple of years and this last year, especially as we start the conversation about what's next for Open. So if we want to go to the next slide, thank you, Kate. So what I want to do next is talk about the Open transition and what it means for Open's next steps in collective action. So before we get into that, let's start with an overview of Open's journey to collective action. I recognize that this will be a review for some of us in the audience, but I think it's important for all of us to be on the same page when we talk about what's next. So Open's collective action strategy, most of us know that as Open's Blueprint for Change, was developed when network members came together to map out the entirety of the current oral health system. And what was realized in that process was that the healthcare system operates as a business and that it is inadequate to best meet the needs of consumers, especially marginalized groups. Mapping out the system also allowed the network to see the gaps, or for those of you who have optimistic eyes, the opportunities for change. Those opportunities were then identified as leverage areas. For many of you, you know the 5 lever areas in the blueprint. Once the leverage areas were identified, the network began to brainstorm every strategy which could progress the work to reach Open's aspiration, an equitable, affordable, and accessible system. So then fast forward to 2022, the lever lead position was created and developed. And so these individuals were tasked with developing a proposal including a strategy with action steps and an implementation plan for the blueprint. Later in that year, the lever leads teamed up with the 2023 design team. This design team was made up of 15 individuals representing the national, state, and community voice of Open. Together, this group assessed Open's existing infrastructure and proposed recommendations for how to work most effectively together in the coming years. So I just want to take a moment here to pause and say that we understand what a great undertaking it has been to complete this tremendous amount of work, and we want to applaud all of those of you who were involved. So where does that leave us now? This year, CareQuest Institute will pick up where that work left off and carry out its own due diligence to ensure that the collective action strategy is, number 1, sustainable, number 2, is linked to measurable impact, and number 3, that the Open infrastructure is well positioned to carry out the work in the future. We know that having the network voice represented throughout this process will be critical. So opportunities for network members to inform the evaluation, whether it's completing surveys or participating in future meetings, will be built in this process. We can go into the next slide, please. So now I want to talk about how network members can remain engaged during this transitional period. And so here are a few ways or activities that most of us are familiar with, and a couple of new ones as well. So we hope that you will continue to be active on Open Communities. This is our centralized communication platform that Open uses to network, to join communities of interest, to post discussion items, and explore resources. What's really amazing about the network and the reach that Open has is if you have any question related to the oral health field or a challenge, if you post it in Open Communities, it's amazing how that you will find someone who has a response or guidance for you. The second way to stay active is to engage or is to join or continue to join a network response team or learning collaborative. These are issue-based groups that participants can join to further their knowledge of certain oral health topics and learn of opportunities to take action, like we just heard from a couple of our NRT leads earlier. The meeting schedule for the NRTs will be posted on Open Communities soon. We also hope that you will join us at the annual convening. This is our opportunity to connect with one another, to build an aligned vision for oral health transformation, take away practical skills, resources, and tools. We also hope that you'll join us in Hill Day to elevate the importance of oral health policies and to demonstrate a unified voice in front of members of Congress. And lastly, I'm excited to share a newer opportunity for a couple of you. We invite you to join the CareQuest Institute learning communities. These are 1-hour calls to learn skills and disciplines in oral health and hear examples and stories from the field that can help participants progress their own work. So I'll stop there and have Frances take us into our next steps, and then we will go into our Q&A session.
Thank you, Bianca. Hey, everybody, I'm Frances Walsh. So before we turn to the Q&A section, I'll give you an overview of our next steps. I just wanted to make a reminder that we have the chat box for chats. Any questions that you have, the Q&A button is 3 to the right from that chat box. So if you want to drop in any questions that you may have there. So we will be sharing the recording and a copy of the slides after this event has transpired. For all of the 2022 Open Formal leaders, please look out for an email that will be coming to your inbox tomorrow with more detailed information on how to reapply for your leadership position this year. Please join us on February 21st at 2 p.m. Eastern for a refresher course on our online virtual community known as Open Communities, which is at communities.openoralhealth.org. You can learn about the platform's features and capabilities to stay connected on and network within our community. And we are working on identifying dates for the Open annual meeting, as well as a strategic date for Open's Hill Day, so we can plan around what will have the greatest impact. So we will be sending out save the dates for both events soon. And now I believe we are ready for our Q&A. So I'll turn it back over.
Great, thank you so much, Frances. So while I want to welcome people to add their questions to the Q&A chat box or the comment chat box, we'll keep our eyes peeled. Before we turn to those, I just want to make sure that people also feel free to reach out to me with any questions or concerns offline, and I will add my email to the chat. So with that, I'm just checking out what our cues here. Okay.
So this is Trinae. I will say, so I see a question about, will Open leadership that guided us the past 3 years continue to be advisory to Open 2.0? Nancy, you want to say thank you for that question itself. I think so. What I would say is that we are using this year to really figure out what's the best leadership structure that can and should be in place to align with Bianca's main points around ensuring that this work is sustainable and impactful. And so with that, we're using this time to figure out what's the best structure and what is the best infrastructure. So for the NOCs, the ROCs, et cetera, to sort of align with that vision. And I think we'll have more of a concrete response over the next several months as we hear from the current network leads, as we hear from broader network members, and also as we are continuing to be under the guidance of the CareQuest Institute, if that's helpful.
Yeah, and I just want to thank you, Trinae, for that. I just want to add that our goal is to make sure we lean into our engagement with the community-based organizations and also carry through the momentum that's been generated by all of you out there, and make sure we are respectful of the work that's been done in the past, with a focus towards a sustainable future, so that the work of the network can proceed. With that, I'll also underline that there's a lot of questions that are absolutely pertinent and important to be able to have an answer for, but let's just say that this is a lot of it is work in progress, and we're evaluating every option, again, with a lens towards having meaningful impact, sustainability, leveraging the voice of the community-based organizations and activists and all of you out there. Stacy's asking about the annual meeting be in person. That's not been determined yet. Would you please repeat what you said about renewing roles with open? And I think that ties into Lori's question regarding the role of Knocked and Rocked and how it will exist. And Steve asked that question as well. That is also being evaluated. Will the Knocked and Rocked continue, as Kaz implied earlier? Steve, I don't know when earlier that was, and I know you and I had a chance to converse about this as well. I did like where you said you were from, that was actually pretty awesome. You said you were hailing from Woodford Reserve. That was actually awesome. But I'll just say this: the organizational and the organizational structure and the leadership tiers. I think those are all open to. Will there be reviewing, appointing formal leader position, and will previous leaders be considered for these roles, given they have put so much into them? We want to. I don't know who this anonymous honoree is, but that's a great question, right? Because to uplift and to highlight and to honor the work that's been done in the past is going to be really critical in this next empowered, focused, dedicated pathway that the network will head into. Can you expand on new structure in comparison to our past structure? Will we have state representation? Those are great questions. These are all great questions. This is the kind of feedback that we want. This is the kind of energy that we knew it would be present in this environment. We have not formalized what the leadership structure is going to look like. Again, though, I will just say this: we want to make sure that the leadership structure within the network out there honors the work that's been done. It is impactful, it is focused, it is dedicated. We knew it so that we can identify where our areas are most impact are going to be moving forward. Then that we can leverage the most of our capabilities and energies with a focus towards impact, focus towards making change, focus towards that structural transformation that we just spoke of at the beginning. I wish this was refined. I wish we had all these amazing questions answered. But the truth of it is, the network has, back to what Aoife said, the network has done quite a bit of work. This network is important. It is absolutely critical, which is why we wanted to make sure it was it was set on a path of sustainability, and to be able to really truly capture the impact and honor the work that's been done in the past, as well as each individual member, and member organization that's contributed to this work. We want to be intentional about our approach. We want to make sure we are capturing the voice of those who have done the work in the past, so that we don't, in our goal to have this transition, we don't unintentionally exclude voices. I hope that answers it. it would have been beyond aspirational. It would have been almost, I would say, a pipe dream for us to show up here with 24 days into the new year and have all these amazing, incredible questions answered. But I too felt that the earlier communication indicated continuation of NOC-ROC state reps. Well, I'll just say this. We want to make sure the transition does not mean turning the tables over. Continuation of NOC'd and ROC'd. If you read that into the communication that was sent, that's fine. I would say, if I were to give that a fair assessment, I would say you're certainly entitled to read that into it. But I will say, I would say that it's honored and continue. Will not, this work is honored and continue. I'm sorry, trying to keep up with this. I apologize. It is like a live chat session at one of those gaming sessions that my son holds.
I'll just jump in quickly to say too, as Francis mentioned in next steps, that the folks who are formal leads in 2022 are going to receive a communication tomorrow about what it means to be a formal lead in 2023. So we hope that you'll read through that and see what the updates and continuations are, and then we can have a conversation after that. But to just tie back to some of the questions about continuation, so there will be continuation for the NOC'd, ROC'd, lever leads, and NRT leads, as described in the message sent out from CAS, I believe in December. I think that's what some of you were pinpointing to in the quick Q&A section. Yes, from the anonymous attendee, that is what I'm referring to. So, correct. Tomorrow, those formal leads who are in NOC'd, ROC'd, state, grassroots reps, lever leads, you'll receive your next steps tomorrow.
Another question from Tony Russell. So, John, I don't know if he's I feel like he's not he could prepare to introduce yourself in a moment, John. I think you're the newest member of our team, so it makes sense to do that. And then we'll also include the contact information in this email, Lisa, in response to your question. John, you want to introduce yourself, please?
Yeah, absolutely. For everyone who I haven't had the fortunate chance to meet yet, my name is John Gabelis. I'm a Grants and Programs Associate at CareQuest Institute. I've been here with the organization for about 1.5 years at this point. And so, also serving as a resource for communications around the grant making process or all things related to Flux.
Thanks so much, John.
There's a question around the Encompass board. We appreciate their help in while they were around. The backbone structure and the administrative support now resides within CareQuest Institute. Jan says maybe a second follow-up letter would be helpful. As Bianca said, we're going to have communications as to what the leadership will look like. Anonymous attendee says, can I join as a new member this year? We encourage you to join. Anonymous attendee. Trying to scroll up.
I'm not seeing any new questions. I think there be a transition to health outcomes goals versus, will there be a transition to health outcome goals versus the historical process goals? I think I need a little more information on that question. More context.
I think this is Trinae. And please feel free, whoever entered the question, to expand on it. I think what I'm hearing, or how I would interpret this, is that traditionally with open, some of the goals have been more process oriented, about meetings, about engagement, et cetera, and and this is that sort of long-term aim. But I think in the intermediate, there's this question of like, what are the actual outcomes that are associated with the work that we're doing? And so I would say that that's been actually elevated as a piece of work that we want to focus in on for this year and moving forward, so that we are not just thinking about the inputs of our work, but also the outputs. And how are we actually making a difference in policy, but also in people's lives? And what does that look like, with a special and specific emphasis on historically marginalized and underserved populations? If that's helpful.
Thanks, Trinae. I'm also here. Okay, so I want to get back to this question. Am I understanding that decisions regarding leadership will be emailed instead of discussed on this webinar? Correct. So tomorrow, as I've mentioned earlier, those who held positions last year will receive instructions for how to apply for their positions this year. Someone has asked, how do I join? And is that, how do I join Open Communities? I saw that in the chat, and I apologize if I'm missing the context. So Sonia, if you can, will you send information about how to join? If you can clarify on the join, please let me know. Oh, how to join Open, yes. Well, how to join Open is definitely by starting your profile on Open Communities. And so I will grab that link for you and put it in the chat. We're checking to see if other questions are coming through. I believe someone is asking, how diverse is the membership relative to the profession? Are we referring to the open membership? If we're referring to open membership, we can take a look at our stats through Open Communities and follow up with you on that.
Yeah, Nancy, I know I back again to my question. You wanted more clarity about sustaining past efforts and plans moving forward. I'm grateful for your patience as we do this. The transition of the network over to CareQuest Institute and all the work, the body of work that's been done. We're trying to make it as uninterrupted as possible. But this does not mean that we cannot in evaluation, and which is part of our charge, in evaluation of our work as we plan for this year into 2024, this does not mean that we don't look through the entire body of work, the leadership structure, and reevaluate and reassess where we are and make sure that it makes sense in the context of the work that we're doing. And it's in the alignment of the network to where our advocacy and our work towards health equity is aligned with here at CareQuest Institute. So anonymous attendee, I know you're repeating that question. Will that work be honored and continued? I'll just say we're trying to make the transition with as few disruptions as we currently see and are able to do. But this is a work in progress. we are going to, part of our charge also is to keep you informed, keep in communication with you in a more rapid cadence. And again, anchoring back to what I said earlier, while I wish we had a fully baked solution here in 24 days, we just don't.
Thanks, Kaz, and I can switch to.
Thank you,
answer-
Nancy. That's yeah, but I would say co-alignment. Thank you for that.
I want to jump in and answer Jan's question about how we will handle overall communications. We will still continue to use open communities as our primary method of communication. You are also going to continue to receive emails from Open's MailChimp, so you may see that coming in as well. But you can always reach out to me directly as your primary contact for the Open transition, and we can make sure to best answer your questions as they come in. So I think we'll give it another minute or so for any last minute questions. Otherwise, I think we can wrap it up. Want to thank anonymous attendee for shouting out that they believe there is a lot of opportunity for rethinking Open and what it could look like in partnership with CareQuest.
Before I turn it back to Bianca, probably to close us out unless we get any other questions, I just want to explicitly thank you all for your feedback, for your questions, for your transparency. As you know, this is a new process that we're embarking on together in collaboration. And so all of your thoughts and questions will really inform the work as we move forward. So I appreciate that feedback and thank you.
Thanks, Trinae. All right, well, thank you so much, everyone, for joining us today. We are going to wrap it up here. Really looking forward to connecting with all of you one-on-one and in future meetings. As Francis mentioned, we will be sharing out a recording and a copy of the slides soon. And we want to wish you a wonderful rest of your afternoons. Thanks again. Bye, everyone.